Have you ever wondered why keeping track of your blood glucose levels is a vital part of maintaining good health? This isn't just a question for those living with diabetes or prediabetes. It's a question we all should be asking ourselves, because understanding our blood glucose levels is key to understanding our overall health and well-being. So what exactly is blood glucose? It's a type of sugar that your body uses as a main source of energy. It comes from the food you eat and is carried to your cells to give them the fuel they need to function properly. But like many things in life, it's all about balance. Too much or too little glucose in your blood can lead to health problems. Let's focus on why it's crucial to keep an eye on these levels. First and foremost, balanced blood glucose levels ensure your body is functioning at its best. It's like making sure your car has the right amount of fuel, not too much and not too little. It helps you feel energized and alert, rather than tired and sluggish. For those living with diabetes or prediabetes, monitoring blood glucose levels is even more critical. It's a key part of managing the condition and preventing complications. But it's not just for them. Even if you don't have a pre-existing condition, understanding your blood glucose levels can give you insights into your body's overall health. Perhaps you've noticed that you're often feeling tired, or your mood seems to fluctuate more than usual. These could be signs that your blood glucose levels aren't where they should be. By regularly monitoring and understanding these levels, you can take steps to improve your energy and mood, but the benefits don't stop there. Regularly measuring your blood glucose levels can help identify potential health issues before they become serious. It's a proactive step you can take towards maintaining good health and preventing future complications. Understanding and managing your blood glucose levels can be a transformative step towards a healthier life. It's not just about preventing illness or managing a condition. It's about taking control of your health, understanding your body, and making informed decisions to live your best life. Before jumping into the process of measuring your blood glucose levels, it's important to know what these levels actually mean. Blood glucose, also known as blood sugar, is a vital source of energy for the cells that make up our muscles and tissues. It's also the brain's main source of fuel. This glucose comes primarily from the food we eat, and our body regulates blood glucose levels to keep us in a state of balance. Let's talk about normal blood glucose levels first. In a person without diabetes, blood glucose levels typically range from 70 to 100 milligrams per deciliter after fasting, that is, not eating for at least 8 hours, and rise to less than 140 milligrams per deciliter 2 hours after eating. These levels fluctuate throughout the day, but stay within this range. Low blood glucose or hypoglycemia occurs when the level of glucose in your blood drops below normal. This can happen if you skip meals, exercise more than usual, or take too much insulin if you have diabetes. Symptoms can include feeling shaky, sweaty, hungry, and irritable. Severe hypoglycemia can lead to seizures, coma, or even death. On the other end of the spectrum, high blood glucose or hyperglycemia is when your body has too little insulin or can't use insulin properly. This can be due to consuming too much food, being sick, or not taking enough diabetes medication. Over time, high blood glucose can lead to serious health problems affecting the heart, eyes, kidneys, nerves, and teeth. Understanding your blood glucose levels is crucial, not just for those managing diabetes, but for everyone. It's a key part of maintaining a healthy lifestyle, as it can help you make informed decisions about your diet, exercise, and medication. Now that we have a basic understanding of blood glucose, we can proceed to how to measure it. Measuring your blood glucose levels at home is simple and straightforward, but you'll need a few key items. First up, a blood glucose meter. This small device is the heart of the operation. It's what reads your blood sample and gives you a glucose reading. Next, you'll need test strips. These are specially designed to collect your blood sample and transfer it to the meter for analysis. And then, there are lancets. These are small, sharp instruments used to prick the skin and draw a tiny drop of blood. You'll also need a lancing device to hold the lancet. It's a small plastic piece that helps you control the depth of the prick to minimize discomfort. Let's not forget about the control solution. This is a liquid that contains a known amount of glucose. It's used to ensure that your meter and test strips are working correctly. With these tools in hand, you're ready to measure your blood glucose levels. All right, you have your equipment ready. Now it's time to measure your blood glucose levels. First things first, make sure your hands are clean. Wash them with warm, soapy water and dry them off thoroughly, because any residue or moisture could potentially impact the test result. Once your hands are clean, it's time to prepare your glucose meter and test strip. Take your glucose meter and turn it on. If it's battery operated, check to ensure it's fully charged or the batteries are in good condition. Insert the test strip into the strip port of the glucose meter, making sure it's the correct side up. Now it's time to draw a small blood sample. With a lancing device, carefully prick the side, not the pad, of your fingertip. The sides of the fingertips are less likely to become sore or calloused. Press gently until a small droplet of blood appears. Once the blood droplet is ready, bring the tip of the test strip to touch the blood. The strip should draw the blood up into it. Be mindful not to smear or wipe the blood onto the test strip, as this could lead to inaccurate results. After the blood has been absorbed by the test strip, wait for the meter to calculate the glucose level. This usually takes a few seconds. The glucose level will then be displayed on the meter's screen. It's important to note that blood glucose levels fluctuate throughout the day. They are typically lower before meals and higher after meals. So when you measure your blood glucose levels, remember to take this into account. Once you've read your result, remove the test strip from the meter and dispose of it properly. It's crucial to remember that test strips are for single use only. Now let's talk about the lancet you use to prick your finger. It is vital to dispose of it safely in a sharps container, not in regular household trash. This is to prevent accidental injury or infection. If you don't have a designated sharps container, a heavy-duty plastic container, such as a laundry detergent bottle, can be used as an alternative. After you've disposed of the test strip and lancet, it's a good idea to record your reading in a logbook or digital app. This will help you and your healthcare professional track patterns and trends over time. Don't forget to include the date and time and any notes about your meal or exercise routine that might have affected your glucose level. And there you have it. You've successfully measured your blood glucose level. Great job on measuring your blood glucose level. But what do these numbers mean, and what should you do next? Let's start by breaking down the results. Normal blood glucose levels are typically between 70 and 100 milligrams per deciliter before meals, and less than 140 milligrams per deciliter 2 hours after eating. If your readings are consistently higher, it could indicate prediabetes or diabetes. If they're frequently lower, you may be dealing with hypoglycemia. But don't panic. These numbers aren't a diagnosis, but a tool to guide you. If your readings are outside the normal range, it's advisable to consult a healthcare professional for further evaluation and advice. They can help determine if additional tests are necessary and guide you in managing your blood glucose levels. Now let's discuss the next steps. If your blood glucose levels were within the normal range, keep up the good work. Maintain a balanced diet, regular exercise, and adequate sleep. These factors can help regulate your blood glucose levels and overall health. Should your levels be a tad bit higher, consider taking a look at your diet. Foods high in refined sugars and carbohydrates can cause your blood glucose levels to spike. Try to incorporate more whole grains, lean proteins, fruits, and vegetables into your meals. Regular exercise also helps your body use glucose more effectively. If you found your levels to be consistently high or low, monitoring your blood glucose over time can provide valuable data. It allows you to identify patterns and understand how different factors like food, physical activity, and stress affect your levels. Lastly, remember to always consult a healthcare professional if you have concerns. They can provide personalized guidance and treatment plans to help manage your blood glucose levels effectively. Remember, understanding your blood glucose levels is an important part of maintaining your health. Stay informed and stay healthy. Before we end, let's quickly recap what we've covered today. We've delved into the vital significance of measuring blood glucose levels and how understanding these levels can help manage your health. The essential equipment needed for this process was discussed, followed by a comprehensive guide on how to measure your blood glucose. Ultimately, interpreting these results is key to taking the right steps forward. Thank you for joining us in this journey towards better health. Remember, knowledge is power, especially when it comes to your well-being.